Welcome friends. My name is Dr. Shobit and today we will be seeing a lecture on Anchorage. But before starting the topic, I want you to get few points clear in your mind. First of all, what is force? As we all have studied in the school that force is equals to mass times acceleration. Now this force could be a pull force or a push force. But in both the scenarios, whenever we are applying any force, then some amount of resistance is always felt, whether it is a pull or a push force. So, in simpler terms, we can say that anchorage is nothing but resistance to this force. Let's see an example for the same. Imagine a ship which is coming to the dock or the shore. So what does the sailor does? The sailor drops an anchor into the sea so that the ship doesn't move. But some amount of resistance is still felt by the ship. So in this term, we relate anchorage to it. Okay. It is nothing but whenever we are applying any force, the resistance is always seen to that force. This is called as anchorage. Now the force can be generated from the orthodontic appliances as well. Whenever we are planning orthodontic treatment, it's simply not possible to consider only the teeth that are moving, but the reciprocal movements throughout the dental arch must be evaluated, analyzed, and controlled. Now we will all see one example. We all have studied the Newton's third law of motion. What does this law says? It states that for every action, there is an equal and opposite reaction. So if we are applying any force, then an equal and opposite force will be applied to us as well. Now we'll see this by an example. Now in this scenario, I've wrote the tooth number. This tooth number denotes the teeth that are moving and the teeth from which the anchorage is taken. Now in this you can see that I have used the number 1, 2 and 3. This symbolizes for the incisors and the canines. And 5, 6 and 7, these resembles the premolar and the first and the second molars. This space which is in between is for the is in the cases where we have extracted the first premolar, like the class 2 div 1 or severe crowding cases, in which we usually use this regimen. So now we'll see what happens in this scenario. Now we are pulling the incisors and the canines using the force from the second premolar and the first and the second molars. Now we'll see what happens. Now as you can see, the teeth have moved to a new place somewhere over here like this. But now we in this phenomenon we can use any friction or frictionless mechanics. That is a different part to study. But now see what happens. Have you noted that the teeth, that is the posterior segment, now we'll call this as the anterior segment. We call this as the anterior segment and this as the posterior segment. So whenever we are pulling the anterior segment from the posterior segment, means this is this teeth, these set of teeth, posterior teeth are pulling the anterior teeth. So the anterior teeth are getting displaced to a new position, and the posterior teeth, they are also getting dragged somewhat easily. Okay. Now the force which is used to move the teeth, this force is derived from certain anatomic areas which act as an anchor. The resistance that the anchorage area offer to these unwanted tooth movement is called as anchorage. As we've already seen, anchorage is nothing but resistance to displacement. So resistance to any force is termed as anchorage. Now we'll see anchorage consideration if force is applied entirely to a teeth. It indicates the resistance needed to prevent undesirable tooth movement while permitting movement where desired. It indicates the type of resistance the teeth will offer. So that indicates gradually the type of tooth movement. It determines the type of appliance that must be used to produce this type of movement. Now coming to the definition of anchorage. As per Graeber, anchorage in orthodontics is defined as the nature and degree of resistance to displacement offered by an anatomic unit for the purpose of effective tooth movement. Now we'll see the sources of anchorage and the general principles. Now there are various sources of anchorage, that is the intraoral sources, that extraoral sources. So first we will see the intraoral sources. In intraoral sources, first mainly is the teeth. Now the teeth, for the anchorage to be provided by the teeth, there are various factors. Now we'll see those factors. First one is the root form. Now in root forms, there are basically three types of root forms as we have already been studied in the second year. We'll just go through it. That is the round, flat and a triangular one. So the round root form, the teeth having a round root form, these offer less resistance as the resistance is offered only at a single point with less surface area. The examples of these teeth are the bicuspids and the palatal root of maxillary molars. Coming to the flat root forms, here the teeth which are wider buccolingually than mesodistally. These teeth offer more resistance even than the triangular ones. The examples are the incisors and the buccal root of maxillary molars. Now finally coming to the triangular root form, these offer maximum resistance due to greater surface area. Now coming to the second point, that is the root length. Larger and longer rooted teeth offer better anchorage as they are deeply embedded in the bone, that is the maxillary canine. Maxillary canine has the longest root among all the teeth. Now coming to the next point, that is the number of roots. Multi-rooted teeth have greater resistance than single-rooted teeth. Size of the tooth. Larger tooth act as a better anchorage due to large surface area, that is molar as compared to the premolars, provide better anchorage. Inclination of the tooth. Greater resistance is offered when the force is exerted in the opposite direction. The example of this is that when the molar is distally tipped, so it provides better anchorage than the uprighted tooth. Number of teeth. Multiple teeth act as better anchorage as group of teeth resist more displacements. Ankylosed tooth. Ankylosed tooth serve as excellent anchor because in that the PDL is not present and the tooth is directly attached to the bone. Now coming to the second point, that is the bone. Anchorage is now taken from the bone. The mandibular bone has less amount of bone marrow. It is more dense, therefore better anchorage. It provides a better anchorage than the maxillary bone. The examples of uh, anchorage from the bone is hard palate, the lingual surface of the mandible. Now the anchorage, it is affected by if there is any underlying bone disease, periodontal disease, and it also depends upon the trabecular pattern. Now we'll see how muscle plays an important role in providing anchorage. It mainly depends upon the hypotonicity and the hypertonicity of the muscles. Hypertonic muscles can be utilized as an anchorage. For example, lip bumper. If the lower lip is hypertonic, then in those cases we can give a lip bumper, and which later on can be used for the discoloration of the lower molars. Now coming to the last one, that is the implants, which are commonly called as mini implants, which are very common nowadays. That is the temporary skeletal anchorage device. This provides the best anchorage. Now coming to the extraoral sources, now we have finished the intraoral sources. Now we are coming to the extraoral sources. So extraoral sources, these provides additional support for the intraoral source, prevents the procumbency of the mandibular incisors, it prevents the buccal series of teeth from shifting forward, and they can move the entire arch distally. Examples of the extraoral source of anchorage are, that is the cranium. When the anchorage is derived from the cranium, that is by using the high pull headgears. Then when it is used from the neck, nape of the neck, then it is provided by the cervical or low pull headgears. The straight pull headgears take anchorage from the occipital region, and the reverse pull headgear take anchorage from the facial. Now coming to the classification of anchorage as given by Moyers. First one is as per the site of anchorage. It could be intraoral or extraoral, as we have seen. As per the jaw involved, it could be intramaxillary or intermaxillary. Intramaxillary is when it is within the same arch, that is within the maxilla or within the mandible. That is intramaxillary. Intermaxillary when both the jaws are involved, that is the maxilla and the mandible. As per the manner of force application, that is simple, stationary, and reciprocal. Now, what is simple anchorage? Simple anchorage is nothing but when the manner and application of force tends to change the axial inclination of the teeth by tipping, then it is called a simple anchorage. When the anchor teeth are moving using tipping type of movement or by tipping movement, then it is called a simple anchorage. What is stationary anchorage? Here the manner and application of force tends to change the axial inclination of the teeth by translation. Means the teeth are getting translated. This is called a stationary anchorage. And reciprocal anchorage is nothing but when the anchor tooth and the teeth from which anchorage is taken are equal and opposite. Then it is called as reciprocal anchorage. And lastly, as per the number of anchorage teeth, that is single or primary. When the anchorage is taken from a single tooth, that is called as single anchorage. When it is taken from multiple teeth, then it is called as compound anchorage. And when it is taken from multiple sources, that is taken from the intraoral as well as the extraoral source, a combination of these, then it can be termed as a reinforced anchorage. I hope I was able to brief you about anchorage a little bit. So this is the end of part 1. I will get back to you in the second part. Thank you very much for your patience listening.